We're all familiar with a headache. It's usually the throbbing pain in one area of our head. Sometimes it starts at the back of our head and moves forward or vice versa. And in some cases, it becomes more intense. You get sensitive to light and get nauseated. That's no longer just a headache. It may be a migraine. On the program today, we'll help you understand the difference and to help you avoid triggers and get quick relief along the way. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program today are Dr. Jose Miguel Medrano. He's a neurocritical care hospitalist at St. Luke's Medical Center. We're also joined by Dr. Carmi Margaret Marshall. She's a pain specialist and anesthesiologist at Manila Doctors Hospital. It's good to have both of you on the show. Now, first, I'd like to start this discussion with what a headache is, because a headache is common. Its causes can vary from medical conditions to even stress. But a migraine is another story. Dr. Meg, let's explain the difference between these two.
Headache is actually the umbrella term for pain that you experience in your part of your head, and under it is migraine headache. So migraine is actually a type of headache which can be moderate to severe, and most of the time it can be triggered by things that are happening in the patient's experiences.
Now, let's go back to migraines and how its episodes usually happen in stages.
So migraine headaches occur in stages, and the first stage is prodrome. So at this point, the patient would not experience the headache itself, but a constellation of symptoms may be happening. It can be nausea or something like feeling sick in the stomach. It can escalate to vomiting. It can also be presenting as difficulty concentrating and also difficulty continuing with the activities of daily living.
That's right, no? So migraines often send out warning signs before they hit you, maybe even a day, sometimes 2 days before that. And that is what you mentioned, called the prodrome stage. Now, Dr. Migs naman, what are some of the warning signs kapag isang tao ay malapit na magkaroon ng migraine?
When we talk about the prodrome of migraine, we're actually talking about two separate stages. And the first is what we call the premonitory stage, or parang may mga warning signs po talaga. So these are very common hours or days before the headache starts. And usually you see fatigue, neck stiffness, difficulty concentrating, parang palaging antok, increased thirst, tapos marami pang other symptoms na iba-iba yung features.
Now, Dr. Migs, another sign also is itong tinatawag na food cravings. Why is this so? And there's also an explanation. You said palaging naaantok. Paano ito nagiging sign ng isang migraine?
Okay, so to explain that, we have to understand why migraines occur. And there's basically three major mechanisms that migraines happen. And one affects what we call the hypothalamus. Para po siyang control center ng brain na nagme-maintain ng ordinary functions ng brain natin. And when that's affected, nandun din yung control for hunger, control for thirst, control for sleep, even control for other metabolic processes. Kaya kung affected yung hypothalamus natin, which is very common in migraines, you get all of these symptoms.
Let's move on to the next topic, which is migraine with aura. What does this mean, yung pagkakaroon ng aura?
So usually we associate aura with something that's visual, but it's actually, it can happen with other symptoms, but most of the time, if it's visual, it can be like sensitivity to bright light, flickering light, and then merong mga flashes of light that you experience. It can be like zigzags or something like a blind spot, or sometimes you actually find other colors that interfering with your vision. In another part of the body, some may actually feel like numbness, or you feel like you have decreased sensation in one part of your body, and that's also part of the aura. So if this can be confused with some neurologic symptoms, So you better check with your doctor if you have this symptom rather than just considering it's aura of migraine.
Okay. Now for Dr. Miggs, if someone experiences some mild symptoms that may be that of a migraine, should that person seek medical help right away, or can they treat this by themselves? And if so, what kind of treatment can they do?
These migraine aura symptoms are very delicate because some of them can also affect like motor strength, your speech, and in several cases, it can even look similar to a stroke. But not all of these cases are supposed to be treated like a stroke. And I guess the patients who would be best able to manage it on their own are those who have already had these symptoms of migraine before. So if you've had a diagnosis of migraine and you've had these aura symptoms, and then this occurs and then you develop a headache, that is probably more likely something that's related to the migraine. But if this is your first time experiencing these symptoms, you should seek medical attention. So what can you do if you have these symptoms? First, pwede po kayo try to identify what triggered it and stop the trigger. So for example, if your triggers are bright lights or very loud sounds, if you have, let's say, a food trigger, try to avoid all of these triggers and try to seek rest. In several cases, if you already have a medication regimen, take your medication for the acute treatment or symptomatic treatment of migraine. And it's better to take it early so that you stop the process before it gets worse.
We're taking a short break, but when we come back, we'll continue the discussion on migraines, the other stages that lead to it, and how to treat it. You're watching Med Talk Health Talk on CNN Philippines. We're your partner in health here on Med Talk Health Talk. I'm Dr. Freddy Gomez. Now let's move on to the actual migraine attack. Napaka-importante po nito. And this usually starts with a dull ache or a pain. Then it grows into a throbbing sensation or pain. Now, Dr. Marshall, what actually happens during a migraine attack? And a lot of people may wonder, how long does this actually last for?
Migraine attacks can start at any time. You can actually have a prodrome, an aura, or none at all. So it can start as a very slow and pain in the head. It's right that it can be dull. It can actually be also throbbing or pulsating. Like in Tagalog, it's tumikintig sa pakiramdam. So usually it's unilateral. And some feel that it's parang your head is breaking. And it's actually because of the triggers that sends signals to the brain, and then the brain sends signals to the rest of the brain, and then chemical messengers would be produced or released, sending the rest of the signals to the body. That's why you also have experiences of other symptoms. So we have a scale of 0 to 10 when it comes to pain, and moderate pain is like 4 to 7, and 8 to 10 out of 10 is severe pain.
If that is the case, what is the best advice that you could give for patients when this does happen, when an actual migraine attack happens?
Okay. So the best thing to do is actually to identify the triggers, as Dr. Nick said. So if you have a trigger and you find a pattern, you will know that the migraine attack itself is near. So you can prevent it by avoiding the triggers. Another thing is actually to time your activities so that you be more functional or you find it easier to do your daily activities. In terms of medications, I said barely is mild. However, still over-the-counter medications will be the first step. And these are like ibuprofen, methylphenidate acid, paracetamol can also be used. And in other terms, we can use simple analgesics or pain relievers. However, if this is not acute, meaning it has been happening for a long time, I advise the patients to actually keep track. If the attacks happen in about 50 times in a month, so you really have to check with your doctor so that they can advise you in terms of pharmacological management.
Okay, and finally, we have the post-drome stage, which happens after the migraine attack. And this can last up to around a day after the migraine. Now, Dr. Miggs, can you please describe to us what happens during this stage?
Yung post-headache stage of migraine is actually a very sensitive time for the brain. So the other two mechanisms that migraine works is that it affects yung vascular system or the trigeminovascular system of our brain. And it also affects yung activity ng brain natin mismo. So parang there's what we call this cortical spreading depression na yung activities and functions ng brain natin from the back going to the front are affected. So after yung migraine, nagkakaroon po tayo ng parang symptoms related to parang cortical burnout or napapagod po yung neurons ng brain natin. So pwede magkaroon ng some neuropsychiatric symptoms like mood changes, irritability, difficulty concentrating, difficulty sleeping. And you can also have other sensory symptoms such as soreness, tiredness, and other symptoms like that. You can also have other changes in your normal body's function, such as changes with your bowel movements. You can become constipated. You can get anorexia. You can get vomiting or many other symptoms. So these prodrome syndromes, the most common po talaga is the tiredness, fatigue, and the difficulty concentrating.
Now, still with Dr. Miggs, does everyone with a migraine go through all these stages?
So as Doc Meg said earlier, there are several types of migraines. There are some people who experience aura. Roughly around a third of people will have these aura symptoms, and two-thirds will not have. So just from that alone, we already know that not all people will experience all these stages. However, once the migraine attack has occurred, almost everyone really will develop some prodrome to one level or another. It will vary a lot between different people, how long these last and what symptoms they develop.
Very good explanation. Now, Dr. Marshall, you mentioned earlier on what type of medications people can take, the over-counter medications, analgesics to help with the pain. But oftentimes, the pain of a migraine is so intense that maybe these type of medications aren't enough in order to lower that pain into a manageable level. Then they have to go to pain specialists. What kind of pain medications can be available for these migraine sufferers that can relieve their symptoms?
Okay. Thank you for that question. It's to clarify also that this simple analgesics can be used for acute attacks. Probably the first time that they experience it, it's not something that's ongoing. So we treat those with abortive medications, meaning you stop the pain right there. However, if you've been experiencing the pain more than like 15 times in a month, that's considered chronic already. And then you have to prevent. You have to prevent the attacks rather than take the medication like 15 times in a month or every day. So those medications are actually medications that are being used for other conditions, such as antihypertensive drugs, anticonvulsants, and these are being used to stop the progression to a daily kind of pain. However, I have to point out that if you are taking the abortive medications every day, they can actually trigger the analgesic-induced headache.
The exact causes of a migraine is still unknown, unfortunately, but it seems to be related to changes in chemicals in our brain. We'll tell you more about that when we come back. Welcome back. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk. Our topic for today, the dreaded migraine. Now, we'll continue this discussion with Dr. Miggs. Doc, what triggers a migraine attack?
So there are actually several triggers for a migraine po. And I think the most basic thing is that there's an acute change in the balance of your body. Whether it's a change in your sleeping patterns, you may be sleep deprived, or you may have increases in stress. You may have a change in diet. You're taking certain foods that can trigger migraines, such as certain wines, cheeses, foods rich in MSG and chocolate. You can even have changes in your environment. For example, from a warm to cold space or vice versa, it can trigger a migraine. And some changes in the body, especially for women, such as your menses, can also trigger a migraine.
We'll go through those examples that you gave a little bit more, no? But first, Doc Migs, why would caffeine or for instance tobacco set off a migraine?
So these food sources such as caffeine and certain risk factors such as tobacco smoking actually induce a somewhat pro-inflammatory state. And as I said earlier, there's a part of the migraine that is caused by inflammation, parang may namamaga, and that inflammation can affect the blood vessels and even some of the nerves of the brain. So it can also be from a withdrawal of some of these foods. For example, if you've chronically taken caffeine and you suddenly withdraw, you may also trigger a migraine in that way. So it's really more of a balance type of thing.
So, ang dami talagang factors from food to stress, skipping meals, to even changes in your sleep patterns. All of these can cause migraines. Now, Dr. Migs, why is this so? Even sleep patterns can be a trigger for migraines?
Yes, definitely. So a change in your sleep patterns, such as if you go experience jet lag when you travel to another country or a time zone, you can actually get migraines from that. If you are a shift worker, for example, if you work in a call center and then you change from morning shift to midnight shift, it may trigger migraines for you if it's very new.
Migraines can afflict both men and women and even children. But it seems that those who suffer more chronic crippling attacks are women. Why do you think this is so, Dr. Marshall?
Actually, in terms of adult migraines, it's more for women than men. And for children, it occurs though more on boys than girls. However, we're talking about adult pain, headaches, migraine attack. It's probably because of the hormone that can be contributing to the interplay of processes that happen during migraine attacks. And also, these hormones are heightened during, for example, your menstrual period. And so this warrants taking medications for the time period alone. However, if you are a pregnant woman woman of childbearing age, and you plan to have a pregnancy and you have chronic migraine, you have to check in with your doctor because the medications that you be taking are probably not applicable for someone who will be pregnant.
Aside from gender, namamana ba ang migraine? Or namamana ba yung susceptibility to migraine?
So actually around 60% of migraineurs or patients with migraine have a strong family history suggestive of migraine features. Now, in the Philippines, a lot of people kasi tolerate po nila yung sakit, so they don't report it as often or nasasanay na po sila. But if you really ask the patients and their family members, a lot of the times it's really within the family. More than half of the people will have migraine or some form of headache.
Okay, now let's go discuss the cure for migraines. Unfortunately, there isn't one really. Now, Dr. Marshall, why is this so? Bakit napakahirap makahanap ng cure for a migraine?
It's hard to have a cure for migraine. Number one, it's trigger-based. So the triggers for each patient would be different. The severity would be different. In terms of pain tolerance, it's actually different as well. So it's best actually to know individually what the patient would need for you to have a good management in order to fight against the migraine attack.
We'd like to thank our guest for today, neurologist Dr. Jose Miguel Medrano and pain specialist and anesthesiologist Dr. Carmi Margaret Marshall. Migraine can be debilitating. It can make you want to retreat to a dark, quiet place until it all goes away. And recovering can also take time. But the good news is we have more options now than before to head off these attacks and help you get quick relief. You can start by making healthy lifestyle choices. Remember, you have it in you to take control of the pain. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. Stay safe, everyone.